The essence of regenerative medicine is an exciting field of medicine whereby we take a site of injury or an area of degeneration that is the source of pain, and we create an environment where we provide all the necessary elements that our body needs to repair itself. As we get older, we usually lose that ability to repair damaged tissue, and that becomes a source of chronic pain for most patients. There are two major ways that we can treat this is by isolating the growth factors necessary to repair that tissue. One of them we isolate from your blood and concentrate platelet cells which produce those growth factors. We can concentrate it 100, 200-fold of what normal repair can happen in that tissue. The other treatment is isolating stem cells from a patient's own blood and providing the actual cells and the building blocks to repair that tissue. We have had great success with patients that have failed other conventional therapies, both injections, medications, and even surgeries. We've had patients that have nowhere else to turn to that have come to us, and we've offered them these options. We're able to properly diagnose the site of injury using things like diagnostic ultrasound, where we in the office can show the patient where the site of injury is, what it looks like, and how it is affecting motion. These therapies are good for any type of injury in muscle tissue, nerve tissue, or even joints. Examples of patients we've seen and we've treated are we had a young man that was 38 years old, was an active cyclist, had done that for years. He had an injury in his heel, which required multiple injections and surgeries, but he was still unable to ride his passion, which was the bicycling. He presented to us. We excited some platelet cells and we injected them to the site of the injury, and he was able to complete a 100-mile race not too long ago. We have had a patient that had a shoulder injury. She was a nurse, 48 years old, primary support of her household. She had to change her job from a full-time to part-time status because of the pain, the decrease in motion. We discussed options with her, and she elected to try some of the stem cell treatments. We injected that to her shoulder, and within 2 weeks' time, she came back to the office very, very happy because she was able to move that shoulder in ways that she was unable to do in the past 3 years. And she was very grateful because she was able to go from part-time to full-time. We also have the case of a 70-year-old grandmother who was unable to do basic things around her house, and she was looking at the possibility of having to be placed in a nursing home for around-the-clock care. She had had prior surgeries on her back. On imaging studies we performed, we saw that she had a lot of scar tissue that had built up there. We elected to try some stem cell treatment to kind of get rid of that scar tissue. She was able to not only improve her motion, but also decrease her pain, where she's able to do her activities at home and play with her grandchildren, and avoided any further surgeries. So these three patients are but of a short example of all the patients that we've introduced this therapy to. And oftentimes these patients aren't aware of this treatment. They've basically been sent to us because their primary doctors have exhausted all other treatment options. And not only are we here to properly diagnose, but we want to identify the source of your pain and understand how it's impacting your life and giving you options to help treat that pain.